As a spine surgeon, I don't think I'd be comfortable putting a cervical disc replacement in a person who was going to be going back and playing hockey or football because I'd be worried about that thing dislodging. So Jack Eichel, as you know, has an issue with his neck, and it sounds like he's had a disc herniation. Sounds like he's had rehab, and from what is being said in the media, is that he would like to have a cervical disc replacement as opposed to a cervical fusion, which is the gold standard when you have a bad cervical disc. And it's not just a herniation at this point. You may have had, I don't know the history, but there are indications to doing a fusion. And I won't go into them, but standard when you're going to get rid of that disc completely is to do a fusion. It's called an anterior cervical discectomy and fusion. This is what Peyton Manning had, and he went off and continued to play football. So, I think in one episode I discussed when players can return to play. If a person has a cervical disc herniation, they've rehabbed, they're asymptomatic, they can go back and play. If a person has an anterior cervical discectomy and fusion, and the fusion's solid, and they have no symptoms, they can go back and play. There's not data out there about cervical disc replacements in hockey players, right? Not in football players either. There is a study that came out of Europe about athletes returning to play after cervical disc replacements. This was in 2017. And it was 2 professional players. They didn't really mention what sport they were, I don't think, in that study. There were something like 20-something recreational players and a couple of people who weren't athletes at all. And everybody got, or weren't serious athletes at all. Everybody went back to playing sports, even the 2 professional players. But again, don't know what those sports are. I don't think it was hockey, and I don't think it was American football, which are very high-impact sports. Now, as a spine surgeon, I don't think I'd be comfortable putting a cervical disc replacement in a person who was going to be going back and playing hockey or football because I'd be worried about that thing dislodging. This is an anterior cervical discectomy and fusion. This is an ACDF. This is what Peyton Manning had. He had the disc taken out. He had an implant put in that had bone graft in it, or sometimes they could put bone, and then they put a metal plate on it. Sometimes you don't have to put a metal plate in front. You can put screws that hold that implant in place, but that bone fuses together. And those types of surgeries in the neck are really successful. The bone fuses almost all the time in people, except people who smoke cigarettes or people who have some metabolic diseases. But most of the time, these things are fused, and the patient, that football player can go back to playing football. The hockey player can go back to playing hockey because that bone is solid, right? They're not at a danger of injuring that level, right? Now, with a disc replacement, you're taking out the disc. And the goal of disc replacement surgery is to try to preserve motion so that you're not transferring stresses to the levels up and below, because there's theoretically a risk of you getting adjacent segment degeneration, which means the disc above it goes bad and the disc below it goes bad also. So theoretically, if you keep that motion there, you're not going to transfer all those stresses. However, this is what happens with a cervical disc replacement. You're having this implant that has 2 or 3 parts, depending on the type of implant. It's supposed to fuse to the vertebral body above it, the vertebral body below it, okay? But the motion then happens either because there's a type of plastic liner that goes in there that allows this thing to move, right? Or there are discs that are all metal, so it's metal on metal. That being said, you have motion. And I would be worried if I was a spine surgeon about if this person had a really high energy impact, could that thing dislocate? Because cervical disc replacements disc replacements can't dislocate. It happened in the lumbar spine. I'm not sure if I've seen any in the cervical spine myself, but they can dislocate, right? If that cervical disc replacement dislocates in your neck, spinal cord's right there. That's going to be an unstable neck. That person could be paralyzed. That's the issue. So I certainly would not want to be the first spine surgeon to do that procedure. I certainly wouldn't want to be the first patient to have that procedure done if I was going to be playing such a high impact sport. My advice would be to do the ACDF. Your pain will be gone, it's going to be fused, you can get back to playing sports. That's my advice I would give to a hockey player if they're trying to decide whether they should get a cervical disc replacement or an ACDF. They may not have it. I don't know if they're going to have that to make that decision as well, because I'm not sure if there's any spine surgeon that would do that procedure.